you should check with your surgeon or proceduralist to make sure when to resume, because sometimes I have bleeding after the procedure or surgery. So your surgeon or proceduralist may delay to resume the blood thinner medication. Please let me know if you have any question in the comment box below. Thank you. What should you do prior to cardiac catheterization or heart cath when you or if you taken blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa? Cardiac cath is the serious surgery, so if you take warfarin and you are stable with your INA history, or if your INA history is stable for a long time, then you should recheck your INA about 2 weeks prior to the procedure. You might need to hold your warfarin 4 to 5 days prior to the procedure. You might need to be bridged with a low injection if you have a history of recurrent blood clot or stroke, or you have strong risk factors for increased risk of stroke or blood clot when you're off warfarin more than 3 days. If you have to bridge with lower NOx injection, and you need to follow your doctor who manage your warfarin or the anticoagulant. Make sure you understand when to start the lower NOx injection and when to stop right before the procedure, and when you can resume the lower NOx injection. If your INR result slightly high, you might require to reduce the dose and recheck in 1 week, or reduce the dose and hold for 4 to 5 days prior to the procedure. For the Eliquis, Xarelto, Badaxa patient, they might need to check the kidney lab, make sure their kidney is normal. They probably need to update the labs if their previous labs were done more than 3 months. If their kidney function is normal, they may need to hold for 2 days prior to the cardiac cath surgery. If they have unstable kidney function or chronic kidney disease, and their creatinine clearance is done then they may need to hold more than 2 days. If they have to for more than 2 days, then they might need to delay resuming the Alaquix, Yeroto, or Badaxa. So the doctor who managed your Alaquix, Yeroto, or Badaxa, or the anticoagulant will give you specific direction or instruction when to hold your Alaquix, Yeroto, or Badaxa, and when to resume. But you should check with your surgeon or procedure list to make sure when to resume, because sometimes may have bleeding after the procedure or surgery. So your surgeon or procedure list may delay to resume your blood thinner medication. Please let me know if you have any question in the comment box below. Thank you. Liver biopsy. What to do prior to liver biopsy procedure if you are taking a blood thinner medication, such as warfarin, Eliquix, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve, even your INR history is stable. And then you need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fix your INR and reduce. You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before you can plan for the procedure. You should follow your doctor who manages your warfarin or the anticoagulant closely to you have a good plan for your procedure. Anytime if you hold your warfarin more than 3 days, then you might need to consider bridging with the lobanol injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, if you have to take a lobanol injection, you need to follow your doctor who manages your warfarin or the anticoagulant instructions closely. Make sure you understand when you need to start the lobanol injection, when you need to stop the lobanol injection right before the procedure, when you need to resume your lobanol injection after the procedure, when you need to completely stop the lobanol injection therapy. If you are taking Eliquix or Xarelto or Badaxa, you should check your kidney labs. Make sure your kidney function is normal. If your kidney labs are more than 3 months old, and you should need update labs. If you have kidney problems such as kidney failure or chronic kidney disease, you might need kidney labs sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you only need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Alaquis Gerato or Badaxa more than 3 days, and you may need to resume about 2 to 3 days after the procedure. If your kidney function is normal, you can resume your Alaquis Gerato Badaxa in 1 day after procedure, the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, then you may need to delay resuming your Alaquis, Gerato, or Badaxa. You should also check with the surgeon or proceduralist when it's safe to resume your blood thinner medication. If any different, you should let your doctor who manages your warfarin or blood thinner medication or the anticoagulant so they can update the recommendation. If you have any question for the liver biopsy procedure, if you are taking warfarin or other blood thinner medication, please let me know in the comment box below. Thank you.